morning. It is Thursday, July 22nd. I'm Jessica Lovell. Welcome into the morning medical update. We will get an update on our COVID cases with Dr. Stites here in just a few moments. But first, are you and your kids ready to get back to school? We look at how you can start crossing off your checklist and get your kids ready. But first, as always, let's get to our COVID count and some thoughts from Chief Medical Officer Dr. Steve Stites. Good morning. I'd ask how we're doing, but not well.
We are not doing well. We are up to 60 patients in the health system. 33 of those are active, 27 are recovering, and I believe we had about 12 patients in the ICU, 6 are on ventilators, and I think we have 3 patients currently hospitalized who are vaccinated. Just to say, we also have had a chief medical officer call today, and yesterday we said we're kind of at a tipping point. Yeah, we're past the tipping point. We're in trouble. And I think what we have to recognize is that Kansas City and Missouri and Kansas are now the epicenter of this wave of outbreak, this third wave here in the United States. And because we're at the epicenter, what's happened is it's moved. It was in Springfield. It is close. It's clearly moved up north. It's also moved south into Arkansas, part of Oklahoma. There's another big outbreak down along the coast in along Louisiana, Mississippi, Alabama, and there's a big outbreak out in Utah. But we, I think, are clearly the epicenter. If you look at the New York Times heat map about risk levels, we are the riskiest area of the country. Stay tuned. I think you're going to find the chief medical officers are going to call for a reinstitution of the mask mandates and social distancing, because we had that discussion this morning and we were all in favor of it because we're in trouble in hospitals. Bed capacity is past its limits. We are now putting patients into what we call alternative care areas. Those are not standard hospital floors, but we don't have anywhere else to put patients. We're all having to turn down transfers. And it's not only that we have a lot of COVID patients, but we have a lot of sick patients. So one of the thoughts before is, well, you should just cancel surgeries. Now, let me think about that for just a minute, because the difference between now and the fall, when there was mask mandates and better infection control guidelines, we didn't have as many people sick with just routine things from the community. We do now. And I think we'll hear that from Dr. Pahud at Children's Mercy in just a moment. But we have a lot of medical patients who are sick. We can't turn that off. That's just going to keep coming. So another reason for going back to those infection control guidelines is because that will help shut off some of that flow of patients as well and open up more beds. But also remember that when we don't do surgeries, we're delaying some things that are really urgent. It's not like that there are that many purely elective inpatient surgeries. Most truly elective surgeries tend to be outpatient now, and meaning that you're going to not even be done in hospitals. The problem is the number of inpatient beds that we have, and we have a severe shortage of those inpatient beds, and that shortage is throughout our community. It has been since late November, December when we were seeing these kind of numbers in the hospitals. Today we are well over 300 in our what we call the core 6 hospitals. Those are the 6 hospitals that have been reporting their numbers of COVID positive patients throughout the pandemic, and that includes St. Luke's Health System and Truman and North Kansas City, Shawnee Mission and Olathe and others and Liberty. And so I think when you look at those numbers, when we go over 300, that's a really bad thing, and that's where we are. What's different between now and then the fall is that the bed crisis in the city is worse for hospitalizations. And that's because, again, all the medical illnesses have come out, all the parainfluenza, the RSV, all these other patients who are hospitalized. You have a lung transplant patient right now who's hospitalized with parainfluenza. And so those things are all out there. And in addition, we've added all these COVID positive patients. The numbers are continuing to rise. We're at the epicenter of this. We are not vaccinated like we need to be, and people have just gone back to trying to live life as normal, when in reality we live in abnormal times. We still live in abnormal times. And I think what we should be fearful of is that we won't be able to give care to those who need it, COVID or not COVID, or cancer or heart attack or stroke, because we don't have enough beds in this city. And I think that's what we're facing. And we're going to start pushing that message out to the public health officials and out to elected officials and others, because we need to, all of us, take action around that. And then we may need to start talking to state officials about where else are we going to get help. We saw in Springfield they tried to put a field hospital up, and maybe we could be getting close to that. The other problem problem we're running into is we don't have enough staff. A couple of things are causing that. First of all, staff are getting sick again. Second of all, we are seeing the impact of the COVID weariness syndrome, where people are just tired and fatigued. They have vacation scheduled. They need that time off. In addition, what's happened is that many of our staff have gone to, like, for traveling nurses, and they're going to other areas of the country, and so there's just this mix. And when you're at the epicenter of it, you have to take the leadership position as opposed to following what others are doing. And other times we saw other people that were the epicenter, be it New York or Seattle or Los Angeles or whatever, and now we are the epicenter, and we're going to have to react like we are the epicenter. We're going to have to show leadership in that realm. I applaud some of the school districts that are saying they're going to mask mandates amongst kids. I'm sure we'll get into that conversation. I think that's really important. But I would just say to our listening audience and our public, the storm is here, and take shelter from the storm. And how do you take shelter from the storm? We know the things that will keep us safe, even against the Delta variant, and those things are the rules of infection prevention and control. They travel with you. They keep you safe wherever you go. We need to reinstitute those, and we need you to get vaccinated, because this is a pandemic of the unvaccinated right now. If you went through the city, as we did that on our call this morning, fewer than 10% of patients are vaccinated. So this is overwhelmingly a pandemic of the unvaccinated now. There is no debate about that any longer. That debate needs to end, because we can clearly demonstrate that this is a pandemic of the unvaccinated now. It is overwhelming our systems. It is overwhelming our ability to care for people, and it's time for us to take action.
All right, thanks for this update.
Not that I feel strongly. Jess.
No, I said usually you walk into the studio every day very happy and excited and happy to be here, but you walked in and said we're in trouble, people.
Yeah, we're in trouble.
So let's get to some reporter questions today.
Hey, good morning. This is Lizzie from 41. What would you say to a person who says they are not getting vaccinated for reasons that include they are A, young and healthy, no underlying conditions, and B, they've had it before?
Yeah, first of all, having it before does not protect against the Delta virus. That's been clearly proven. Second of all, we know that the vaccine effectiveness is about 90% in the real world. A nice article this morning in the New England Journal of Medicine looking at exactly that data. The real world data, not just the scientific data, demonstrates 88 to 92% vaccination success if you complete both of the mRNA vaccines. It's lower. I don't remember the exact number for J&J, but it's still effective. And so I would say it will clearly help us with that. But I think at the end of the day, our age range is 20 to 80. We are losing young, healthy adults now to the Delta variant. This is a different take on coronavirus. This is not only a disease of the elderly and infirmed. This is also a disease of the young and healthy. I think we're going to hear that from children in just a moment.
Other questions? All right, Katie Moore with the Kansas City Star has a question. Dr. Stites, what is the rate of staff vaccination here at the health system? What reasons have employees given for not getting vaccinated? What is the health system going to do to encourage staff to get the shot? Update us on that.
Yeah, great question. So I believe we're about 75% of our staff have been vaccinated, so that's a good thing. What we know is that our vaccination rates are higher in Caucasians and in our staff who have a minority background. So again, we have work to do around that, and we are continuing to try to meet with individual groups and people who are unvaccinated to try and get them to understand the importance of that. We have not mandated vaccination yet. Yesterday, the American Hospital Association came out in favor of mandatory vaccination, even while under a EUA. We're going to examine that recommendation. There are other hospital associations that are saying the same thing, and New York City has said if you're not vaccinated, you have to do weekly testing. So they're strongly encouraging it and actually mandating it for their staff or in the hospitals. I think New York City has 11 hospitals. So we'll continue to look at that. Our stance thus far has been we are going to wait for full authorization discussion before we go to mandatory vaccination, and we need to have that discussion more completely inside the system. In our CMO call today, that came up again about whether or not we should require mandatory vaccination. I think we're all talking about that and examining it. The reality is that we heard also this morning from the Biden administration that they expect the FDA to give full authorization by early fall, so that would be around September 20th or September 21st, I think. So ongoing discussions, and the reasons that people are not getting vaccinated are the exact same reasons we hear from the public. It's really no different.
Other questions? All right, let's get to our guests today. They are pediatrician with the health system, Dr. Stephen Lauer, and research director of Pediatric Infectious Diseases at Children's Mercy, Dr. Barbara Pahud, both joining us. So glad you are here. Dr. Lauer, let's start with you. I want to start with checkups. Cameras came along last week. I brought my kiddos, as I do to you every year as we get ready for school, and it felt like a regular checkup. We went over all the regular things, but I kind of felt like I needed to ask you a lot more questions as my kids are heading back into the classroom. I had those concerns. What should parents be asking when they come to see you?
Yeah, well, the whole philosophy of the well child visit every year is anticipatory, trying to stay ahead of the game, identify problems before they really get to be something big, and then get good strategies in place to fix them. So we'll ask our questions, how are they doing developmentally, physically, behaviorally, but we really depend on parents to come in with a lot of that information to help us understand where their child is. This year, more than many, lots of questions from parents about how to keep their kids healthy. There's so much information out there, so many different sources that I think there's going to be a lot of questions about how to approach school, masking the whole series of things. So parents need to come in prepared for those with that information, lots of questions for us. We're ready, and we think we have good answers for that. So we look forward to having those visits and helping get kids ready for school.
And you had the job of telling Dominic that he would be getting the COVID shot when it was made available. He said no, I say yes.
He was well prepared.
He's well, yeah, he does. All right, so Dr. Pahud, I want to turn to you. First of all, just get a checkup with Children's Mercy. What's going on? Give us an update.
It's busy, just as we heard in the adult hospitals. The problem that we're facing right now is that we've had a year of quarantining. So that's sort of a year of people not mingling, not sharing germs, and just from a regular infectious disease perspective, people have gotten comfortable not getting sick. And most of us probably here remember, oh, it's been a year since I've had a bad cold or since anything has happened. So the problem that we're seeing now is parents don't remember what a sick kid looks like. They're starting to develop fevers. Healthy children, a year and a half, 2, that had been fine before are now coming to the hospital and getting pretty sick. And that is also causing a lot of concern for COVID, because it's very difficult for us to differentiate whether you have a viral illness due to any other virus or COVID. So lots of panic, lots of fear, and we're also short of beds.
Well, and Dr. Stites, weigh in too, because I'm one of those parents that's kind of let my guard down with my kids, and now here we are just weeks out from school. I mean, what should parents be doing? What should they be keeping in mind?
You know, I'd be curious to see what y'all think, but I would be saying your kids need to be masked when they go to school. Mm-hmm. We've got to, again, we're in trouble in the community. We're at the epicenter of this outbreak in the United States. The Delta virus is much more transmissible than the original form from Wuhan, and we need to take it really seriously, because our community's in trouble and our hospitals are in trouble. And the only way we have, what are the powers that we have to take care of that? A, get everybody who's eligible vaccinated. Clearly, that would reduce hospitalizations from COVID by 90%. B, it would wear a mask, because we know that wearing masks and social distancing absolutely works, and it works with the Delta virus as well. So that's what I would say, guys.
Dr. Pahud, what are you telling parents?
Yeah, the problem that we're seeing is exactly the same that you are. This is unfortunately very different times from a year ago when we didn't have a vaccine. We have a vaccine now. So to me, this surge in cases and the amount of disease that we're seeing now is not the same, because we have something we can do about it. So the fact that there's a vaccine out there that could prevent all this disease and help us get back to normal without masks, without social distancing, and people really are so against social distancing and masks, you have an alternative, that is a vaccine. You cannot go back and open the world up without social distancing, mask, and vaccine and expect life to go back to normal. COVID is still here. This pandemic is still here. We can make it go away if we vaccinate. If we don't, we're still facing the same problems.
So earlier this week, we talked about the American Academy of Pediatrics recommending that all kids 2 and up wear a mask back to school. I want to hear from everyone, but Dr. Lauer, I'll just start with you. How do you think that's going to affect cases? How do you think that's going to affect kids and parents?
Well, just reiterate what everybody is saying here. We know that masking, social distancing work. We had a remarkable cold and flu season earlier this year. We didn't have colds and flu. And now pediatricians and family medicine doctors are seeing RSV season in July. I mean, this is truly, nobody's ever seen this before. It just makes the point again that masking and social distancing work. As we get ready for school, I think we all agree kids and educators need to be back in person in school. But to do that while the pandemic is going on, the only thing, well, as everybody said, we have 2 ways. If you don't like the masks and social distancing, get vaccinated. And until we can do that for everybody, including those school-age kids, the masking part just is going to have to play a role going forward to keep the schools safe this fall.
We also have the advantage this year of knowing what worked last year. We were able to get kids back into school with masking, social distancing, and measures where many schools, including the school where my daughter goes, were able to keep schools open and kids safe, going back to school doing very controlled masking and infection control practices where if you're exposed, you stay school. So now we know that works. Now we have a vaccine. What is stopping us from getting these kids back to school and from doing the right thing to allow all of us to get back to normal?
Yeah, I think schools did an amazing job this past year.
No, schools did a great job, and I think what we've learned is that the emotional and mental health toil of being isolated on kids, more so than I think on adults even, is bad on adults, but it's really bad on kids. Kids got to be back in school. That means we've got to keep the environment safe. So how do you keep the environment safe? Well, 12 and older, you need to be vaccinated. Because otherwise what's going to happen is you're not going to have mask mandates and kids aren't vaccinated. You're going to open the schools and then you're going to have to close the schools because the kids are going to be all be sick because the Delta virus spreads so readily. And even if you've had COVID, you can get the Delta virus because it's a little different. And it looks pretty clearly now, I think, and you should help me comment on this, that your own personal immunogenicity against your ability to fight off the Delta virus wanes a little more rapidly because Delta is a little different. So I think the worst thing that can happen is we reopen schools. We're the epicenter. Remember, lots of community transmission again. We reopen the schools. There's no mask mandate, and kids of 12 and above aren't vaccinated. What is the thing that's going to happen? We're going to close the schools. I mean, it's coming if we don't take this seriously, people.
And to answer one of the questions earlier of why should I get vaccinated if I'm young, healthy, and have absolutely no health concerns, the biggest answer that I give teenagers that have not been vaccinated and are getting vaccinated now after I've spoken to them is when you don't get the vaccine, the virus can infect you. If it infects you, the virus has a shot at mutating in you. You may have an asymptomatic infection. You may be fine. But now there's a new mutation in you that can maybe avoid the vaccine immunity that we have. So forget about Delta variant being scary. The next one that is 0% effective against vaccination could wipe this pandemic back to the beginning where none of us that are vaccinated would be protected. So every unvaccinated person is a natural lab for the virus to mutate and may give way for a new strain that makes the vaccine worthless.
And so, as I remember too, you guys have some young COVID patients. You're pretty full. You got a lot more COVID patients this time than you had with the original one. Is that right?
So again, unfortunately, as you said, this is a problem of the unvaccinated, and unfortunately, children less than 12 don't get to choose if they get the vaccine or not. We just don't have it ready yet. We have clinical trials. We're enrolling for them at Children's Mercy right now, but we only have limited spots. We have 36 spots and over 5,000 people that signed up that want to participate. And we get calls every day asking us, can you please let my kid in? We just don't have the spots. So children can't choose to get vaccinated, and their parents and family members can do the right thing by getting vaccinated for them to protect them like we do babies. Try to create a ring around them and around anybody else that can get the vaccine but is not going to develop an adequate immune response. You mentioned some of the patients that are in the hospital are vaccinated, very small proportion, but those tend to be people with immune problems that are not able to mount a good enough immune response against the vaccine. People that are vaccinated that get COVID again will not die, usually will not get hospitalized at all with serious disease if you have a normal immune system. We're trying to get vaccinated to protect those that can't.
I wonder, just Steve, in your general clinic, how much the unvaccinated people are coming around, if you're seeing any movement?
I think we are. It's, there's a lot of concern, obviously, early on, some of it, well thought out and well founded. But as this continues, you just see more and more sick people and this resurgence now. We're slowly but surely seeing people come around. I have a lot of kids that even the beginning of the visit, the adolescents are like, I don't know, maybe not. But then talking to them in the same kinds of way that Dr. Pahud is describing, also bringing up the risk that they put their other family members at, their grandparents at. Slowly but surely they come around, and a much bigger uptake of the vaccine now than we were seeing perhaps when it was first available for the adolescents.
I want to talk about vaccine trials, Dr. Pahud, because I know that's a lot of questions that come in from our community about that, and when we think that vaccine will be ready. What can you tell us?
So I'll give you a quick timeline. We are still enrolling participants right now. We had to delay the trial, which is normal because of the cases of myopericardite that came out. Whenever you participate in a clinical trial, you have to read all the risks, benefits, and if a new risk is found, you have to include it. So that means stopping the study, changing the documents, and including them in there. So we're in the process of finishing the trial. We still need to enroll about 700 children around the country to be done. Now, once you finish that enrollment, you need to bring them back for their second dose 3 weeks later. So that brings us out to late August, right? Then you need to wait 2 months to get data, safety data, to submit to the FDA. So that's September, October. So by the end of October, we may be done collecting the data we need to submit to the FDA. Then you put it into the FDA and they need to review it. So that's at the earliest November. And now I'm talking if everything goes according to schedule, if all the stars align, then we could probably get approval as early as November. Now, do I think that's going to happen? No. I think we're going to be more into early next year because things happen along the way. The FDA gets delayed because they need to review some other product that's more important, or they need to approve the vaccine for adults, and there's only a limited amount of things the FDA can do at the same time. So I'm thinking December, January, February.
Yeah, so don't count on the vaccine as you're heading back into school. Start prepping your kids to be wearing masks.
Count on the mask.
Yes.
Count on the mask. Count on the mask. And
Yeah.
vaccinate everybody that is eligible around your family members. Convince your friends, your family. A lot of people are afraid of talking about the vaccine to people that have not vaccinated. They feel like it's going to be like a political conversation or like it's your responsibility as a human being to talk to other people about the vaccine, and if you took it, tell them your experience. That's going to change people's perceptions. You just need to be willing to do it.
Dr. Lauer, are parents asking you already for your advice on when it is available? Should their kids get it? Is it safe?
Yeah. Every day there's questions about this, great questions from parents, and as always, parents frequently much more concerned about their kids than they are about their own health. So yeah, lots of questions about that. It's just the same thing. We have to get everybody who can be vaccinated so that we can stop the spread of this virus. I mean, it's really, in Kansas City, talking to my mom years ago, there's polio in the late 50s, early 60s, the same kind of thing. Distancing, people couldn't do anything. It was, totally changed how society worked. Then a vaccine came along, people were lining up to get it, enthusiastically took it on, and it changed how society was able to work in the presence of that virus. The same opportunity exists here, and parents are asking those questions and getting the answers from us that yes, when it does become available, the way we get back to a normal life, get masks off, is to get everybody who can be vaccinated.
All right, let's get to our community questions. I know you have a lot of them. Jill, I know you've got them coming in. I do have one from yesterday. I promised Kimberly I would ask this. Kim says, our 15-year-old has mild asthma. He is fully vaccinated. Is it safe to send him back to school? He did online last year, but we don't know if that will be an option this year.
I would say absolutely, as long as you mask him and have everybody else in your family vaccinated.
Jill? Oh, yeah,
Yes.
Dr. Lauer?
Yes.
Yes? That's a strong, hard yes?
Yes.
But I guess that's a yes from you.
Yeah, heck yes.
No argument from you. Jill, go ahead with your next question.
All right, we have a lot of questions this morning. I'm going to start with Rita's because it is so heartbreaking. They were telling me to unmute my mic, but I think you can hear me, right?
Yes,
We can hear you.
Okay. Rita writes, we lost a dear friend yesterday to COVID. He had both Moderna vaccines and was healthy. Hospitalized at Lake Regional Sunday and died yesterday. Why? I thought the vaccine protected. I'm asking Rita how old her friend was, but response, physicians?
It is that the vaccines are 90% plus effective, 95%, and in real world values, it's about 91%. So I'll tell you, on our chief medical officer call today, we all have vaccinated patients who are hospitalized, but it's less than 10%, and most are actually at zero. We run about 5 to 10% of those. I don't believe, I will have to check on this. I'm not going to say that. I was going to say I don't think we've lost anybody yet who's been vaccinated, but I'm not sure that that's true. We'll verify that, Jill. Yeah, I think the problem is it's 90 to 95% effective, and people who are and it's about 1% effective for about 99% effective against death. Unfortunately, 99% is not 100%. Mm-hmm. And that's what just happened with your friend. And I think we should all take heed to that, which is why right now it's vaccination plus masking and social distancing and dedensifying like we've done before, which we know works, will work against the Delta coronavirus, and it'll work here. And that's why we're trying to take this stronger stance. My heart goes out to you. You know, this pandemic, I'm tired. My wife said to me last night, "You are so tired." I am. I'm exhausted. I think we're all exhausted. And I think what's frustrating to us now, we're exhausted when we have an answer, and yet it's back. And for your friend, vaccine wasn't the complete answer, and I am deeply sorry. I know that for 99% of people, it is the answer, but for that 1%, it may not be. And what I would say to you is the full answer is vaccination, masking, and, think about that social distancing, because we know that's the way to stay safe. And the way we can shut the virus down completely is to be vaccinated, because if we're all vaccinated, then the risk of transmission from one person to another stops. And that's how pandemics end. Mm-hmm. They end when there's no host for the virus to get to. And the way there's no host, it's when we're vaccinated. Mm-hmm. This is now... Your friend is an exception. Please know that. It is a very rare exception. But the pain is very real to you. And I do. You have my complete and total sympathies. I have patients, I follow every day, and we've had people die from COVID. But it is largely a pandemic of the unvaccinated now. Mm-hmm. And if you're not vaccinated, you should be scared, because you're at risk. Mm-hmm. Anything else that you'd add? You're the vaccine expert.
The exact same thing. Vaccines work for most people. Of course, I don't know what the situation was, but I do know that there are cases where we may have a positive COVID test and the patient died from something else. So people still are going to die whether they're vaccinated or not from life. Life happens. And you may test positive for COVID, but have very mild disease or just be carrying the virus and have a separate disease process. Now, I'm not internal medicine, but these things do happen, and figuring out what really was the cause of that is also important.
You always have to look at that, too.
I would say the vaccinated population does need to understand, every time you're around a person with COVID,
Bingo.
You're taking a chance. There is a chance that you will get infected. It's small, and the healthier you are, the smaller it is, but there are no zeros in this. And the more we have unvaccinated people with COVID, the more risk there is for everybody, including at much lower numbers, the vaccinated, as this terrible story really highlights.
Having the vaccine is similar to putting your seatbelt on, driving without texting, and driving without having had alcohol. People still will get into car accidents and things will happen even if you take precautions. But hanging out around unvaccinated is like driving, testing, not wearing your seatbelt, and doing that after a party. So what you're doing day to day and how you live your life really changes that variable. So the vaccine is not an all protection guarantee. You still need to think about the situations that you're putting yourself into. And I have walked away from gatherings indoors where I see people that are unvaccinated, even if they're dear friends of mine, because I know people aren't unmasked, and I'm just not ready to do that just yet.
Jill?
All right, Trish is asking, she says, with all the respiratory illness that is going on, she's heard some moms say that she's taken her kids to the pediatrician and they won't test them for COVID. And she said, should I insist on that?
So what we're seeing a lot of right now is RSV and croup in kids. Again, very uncharacteristic for this time of year. So in kids, especially those younger babies, the treatment is really the same. It's like we have to make them comfortable, make sure they can breathe okay, be able to drink and stay hydrated. I think it's always reasonable to have that discussion about what's gained, what's not gained by COVID testing in those younger kids. What's the family situation? What's going on? It's all part of that discussion about what to test. And there's certainly times where it does make good sense to go ahead and test those younger babies. The treatment for it is really not going to be affected by the positive test in the same way that oftentimes being positive for RSV doesn't tell us what to do any different than if we didn't know. It's just another piece of information. So it's part of the conversation with your child's PCP as to what fits the overall story at the time.
Okay, Courtney, Holly, Angela, they're all asking questions about masking and going to school. Their district, one of them, they don't enforce it. So do I keep my child at home? Is it safe?
I'd say as far as I know, nobody has said you can't wear a mask. So this is going to be a discussion within families and parents having to work with their kids to have them understand what's best and safest for them. That's the parent's role in everything with their kid, and I think that parents are going to have to take the lead in this and do what's right for their kids, and that should be masking.
I think part of it too is that they're wondering if my child is masked, what about the 2 or 4 or 5 or 6 kids sitting around him that are not masked? Is my child still safe?
Well, with everything, right, you do what you can. You put the seatbelt on, you don't text. So my daughter is fully vaccinated against COVID, and she's going to go to a school where about 95% of the staff are vaccinated, but there's nothing we can do about the less than 12 that are unvaccinated. And the exposure that other kids that are vaccinated may have if they have a weakened immune system, if they have immune deficiencies, because there are kids like that, people like that all around us. So her and I, we've talked about it, and she's going to go back to school wearing a mask, whether the school requires it or not. And she is very comfortable doing this, and it's the best thing she can do to stay safe. Is it 100%? Nothing in life is 100%, but she's vaccinated, she's going to be masked, I'm doing everything I can, and I want her in school.
And I think that's the other point. You have to weigh the mental health effects of not being in school, right? Because that's a big impact for our kids.
Correct. We know that this past school year, for those students who had to be at home, it was just not a good experience overall. And it's not being safe from COVID. Wrapped up at home is certainly one way to do it, but there's negatives to that and costs as well. So again, on balance, to that specific question, their child will be safer at school, masked, regardless of what anybody else is doing, working on their social distancing. All those things will help as they get back to school where they truly need to be.
And you have to be honest with yourself. If you're worried and you're trying to keep your kid at home because you don't want them to be exposed, but you keep hosting parties on the weekends at home, or going to parties on the ice rink or the indoor ring or the Chuck E. Cheese, really, why are you keeping your kid from going to school is what I would be wondering. And it has happened.
All right, Jennifer says, do children have long COVID issues?
Please.
You guys are so nice to each other. We don't have to answer the question.
No, we want somebody else to answer the question. I think as what we're finding slowly but surely as those cases are starting to come up, the numbers are small, but we're finding as we start asking the questions that our adult colleagues have used for their patients and tying some of these persistent, vague symptoms, it seems in some cases to be getting back to a COVID infection months ago. So I think so far the experience is it's probably less severe, less common than the adults, but much more is going to come about on this topic in the coming months. And again, the best way to make sure your kid doesn't get long COVID is don't make sure they don't get short COVID.
And the classic long COVID that you talk about for adults, I was going to say, that's why I was waiting. We have MISC in children. And MISC is an entity that affects mostly children, not adults. And kids can have long-term heart consequences after having MISC. So even though that doesn't fall in the regular long COVID category, I would categorize it as a long-term chronic illness children can develop after having COVID. The second thing is we haven't seen as much long-term COVID in children because children were kept at home, not going to school. What are we doing now? Unmasking, back to schools, back to summer camps. Kids are being exposed now because now we opened up the world where kids less than 12 cannot be protected, yet the world is open. Who do you think is going to bear all the disease now? So we're going to start describing all these diseases and showing you what's going to happen, which is why, again, I go back to the point of we need to be more careful. I know we're all tired of this. We are, especially in the healthcare system, exhausted from this, but we don't want to pay by seeing children and young people die just because they're unvaccinated or unable to be vaccinated.
Well, I think we have to ask ourselves a question. What are you more tired of?
Yeah,
Masking or death?
exactly.
I mean, that's really the choice. You say, well, it's not going to come to me. Right, it won't come to you. But maybe it will.
The rates in the New York Times this morning was about 1 in 500 Americans are dying from COVID.
It's a big number.
Yes.
That's a big number, folks. And to your point, it's an avoidable number. And that's the part that's so frustrating. This is avoidable, right? Vaccination and social distancing and masking, the rules of infection and prevention and control, which travel with you and keep you safe wherever you go. All you have to do is follow the rules.
This is now a vaccine preventable disease. It
Yes.
wasn't last year when we were having these conversations, September last year. It is now.
And Delta is more transmissible, which is part of the reason that schools are going to be a bigger challenge for us if you're not vaccinated and you're not masked. So then I think what you have to look at it is, if you want to keep your kids healthy, you got to keep them mentally healthy, physically healthy, and emotionally healthy. How do you do that? Because you got to do all three. You can't just do one. I'm going to send you back to school. You'll be mentally healthy. Except now you're going to not be physically healthy. So Delta virus is highly transmissible. The way to keep schools open and healthy and safe, vaccine, masks, distancing. That's the real way. And we've done it. We've proven that we can do it. We just got to do it again.
Yep.
I was talking with Dr. Mitchell Douglas out at Marillac yesterday, and he said that every one of his patients has a COVID story. They know somebody who's had COVID. They know someone who's been really sick with COVID. They know somebody who's missed an opportunity because they had COVID or somebody died.
Yeah, it's real. It's everywhere. Mitchell Douglas, for all those, Marillac is our child psychiatry, psychology campus and child psych hospital. So,
Tara writes, are the COVID cases that we're seeing in the hospital, are they the Delta variant or the Alpha variant? Her question is, the people that are unvaccinated, are they getting sick on the original or the Delta?
it's almost all Delta variant. We send our samples out to Kansas to the state lab, but what we know from wastewater testing is that 95% of strains of coronavirus right now are Delta, and we know that in the United States it's 83%, but in the Kansas City, Kansas, Missouri areas, it's 95%, which is part of the reason that I think we're one of the epicenters now.
Okay, Bailey says that she's heard parents saying COVID isn't severe in kids. It's not any worse than the flu or any other respiratory virus. So why even bother with the mask?
Well, the flu can kill you. So making that comparison is accurate in that flu does kill children every year, so is COVID. And COVID has actually taken more lives in children than flu did in all the last season. So absolutely it's a severe disease, and all you need to do is talk to a mother of a child that has had COVID, or these parents that we're talking about that come in with a viral illness and they're scared of COVID and they want to test, even though right now really if it's just a regular viral infection, we are reassured as pediatricians, but parents are scared. So this is a real fear, and we all have seen the news. There's no conspiracy here. These cases are real. We're seeing them. Talk to any of your friends who are nurses or doctors and see that this is no joke.
Yeah, we're not exhausted and tired and strung out because of a hoax, people.
Yes.
Come on. We see the body bags. We see what's going on in our hospitals. This is not a hoax. This is real, Steve.
And let's not test that idea that kids aren't going to get sick from COVID. Again, children have, adolescents have been isolated over the past year. So while the initial data showed that they were less likely to get sick than adults, it's a different variant, and we're going to put them back into schools where they need to be. Let's not test that idea that it isn't going to be dangerous for kids when we have a simple, straightforward, effective way to keep them healthy, and that's getting everybody right now 12 and up vaccinated.
Jill, oh, please.
I was just going to say, just because COVID affects adults disproportionately more than children doesn't mean we don't care about how many children die of this disease. One child is too many, but this is, again, killing more children than the flu. So even if those numbers don't compare, thank goodness, to the numbers that the adults have, for us as pediatricians, one vaccine preventable death is too many.
Margaret had a question. It seems some people are equating the COVID vaccine to the flu vaccine and think that since there's a new variant that it won't work the same, therefore they're not getting it. She says a lot of people are talking about this on Facebook, social media.
Oh, geez, here we go. The made-up news
I know that's your
network
favorite.
people. Gosh, don't be a rumor reporter.
So the vaccine currently that we have, depends on which vaccine you have, continues to work against the Delta variant. Now, it is less effective than the original strain because of what I explained before. Here's the most important thing, again, we're saying today. Each person that is unvaccinated can develop the next Delta, the next Delta 2, the next Omega, the next whatever all the letters are that follow, that will become more resistant to the immunity we develop from vaccination. So the protection from the vaccine against Delta is less than that against the original virus, but it's still there. And I want to remind you that our purpose of developing vaccine is not to prevent all disease. It's to prevent death and severe hospitalization. You may still get the flu after having a flu vaccine, but it's going to be a flu illness you can endure at home as opposed to being in the intensive care unit connected to a ventilator. That's the goal. So it's really important to continue to vaccinate everybody that's unvaccinated to prevent this virus from continuing to mutate and continuing to find ways of avoiding the vaccine protection we have developed in half of our country.
So can I just say, if you want to be a rumor reporter and listen to the made-up news network, the Muns, then okay, so be it. I can't help you. I just can't help that. But Facebook is not science. I'm sorry. Sorry, Mark Zuckerberg. Someplace out there. But Facebook is not science.
Nor Instagram.
Nor Twitter, nor any of those other
Whatever
social
you're
media
watching.
sites, folks. That is not true stuff. Here's the true stuff. New England Journal of Medicine, lead article, published this morning, and it says, in the summary of it, the Delta variant has surged in India and spread worldwide. In this test of the Pfizer vaccine against both the Alpha variant, that was our listener's question, and the Delta variant, here it is, here's the data. The Pfizer vaccine is 94% effective in the real world against the Alpha variant and 88% against the Delta. And for the AstraZeneca vaccine, which we don't do in the U.S., we do J&J, but those numbers are pretty roughly equivalent. It was 74% against Alpha and 67% against Delta.
I have to add something here.
Please, can you just say one more thing? Moderna will be the same thing as Pfizer. They track exactly all the way. So go ahead.
Incomplete vaccination does not
Yes.
give you those numbers.
That is right. That is
some
totally
people
right.
get one shot and they're like, it hurt. I don't want to do this anymore. Or they forget, or they have a false sense of security. Those are numbers with complete vaccination, which is 2 doses, not one. The effect after 1 dose actually lowers significantly. It can be as low as 33%. Now, 33% is still better than 0, but I would prefer you are protected 86% against Delta or 95% against Alpha than 0 with no vaccine.
So also, just to point out on an earlier question, there is also some articles, a letter to the editor, demonstrating the risk of transmission from kids coming back from summer camp and bringing COVID back to bring the Delta variant back to a household, and that risk can be as much as 45% for household members of getting it if they're unvaccinated. So again, the story is the same one, people. Get vaccinated, wear your mask, socially distance, be safe out there. Don't make your life worse with Delta virus, and you know how not to do it.
Here's the question. What is stopping you from getting the vaccine? What is really the fear? What is the concern? I think we should do a session where we answer people's questions here if that's necessary, because I really don't understand. I really don't understand what the concern is about getting the vaccine compared to all the discussions we keep having here about what the virus is causing. So what is the fear?
I think it'd be a great session. Okay, Jill, I think we just heard another media program coming up for the, what is the fear? Let's talk about fear.
Marisol wants to know, if the virus can mutate in unvaccinated people, can it mutate among vaccinated people? Everybody in her family except the 8-year-old is vaccinated and she's terrified.
No, when you're vaccinated, you prevent the virus from causing an infection in you, as long as we continue to have viruses that protect us with the current vaccine. So right now, the virus, like the Delta, originated in an unvaccinated host. All these new mutants that we have, all these new variants have originated in unvaccinated people. So if you're vaccinated currently, you will not be a lab for this virus. You're not going to help this virus succeed in planet Earth. They're like us. They want to evolve and stay. But if you're unvaccinated, you're exactly what the virus needs, and it's just going to infect you, replicate, and the mutation will develop that can make it bigger and stronger.
Jill, can you give us one last question?
Well, I've sent you 4. I'm asking you to help me out.
All right.
Your cell phone is, girlfriend.
Let me see. Let me pull it up here.
Okay, now we got this is good.
And let me try to find one final one while you ask them 2 or 3 more.
Okay, well, Dr. Stites has got a scooch here in a second, so I'm going to ask Kathy's question. She says her mom is 93, cardiac issues, only vaxxed in her bubble, family all vaxxed, but brother who lives in Springfield is now concerned about visiting because he's still working, has no way to know who is and isn't vaxxed at work. Talk us through that. Should we just go back to staying apart until Missouri numbers start to decline?
Yeah, so the reality is I would assume that Springfield and Kansas City are not that different in terms of how many cases are out there, and so I wouldn't be as nervous about that question as I would about whether or not the brother's vaccinated, because the risk of his bringing it into the household is markedly low, and then just wear masks.
Even if he's out in Springfield?
Yeah, because I think, again, there's widespread community transmission again, and I think Springfield and Kansas City, the dynamics now are no different. We're as bad as Springfield, or not nearly as bad. So we are almost nearly as bad as Springfield. And so I think what we have to recognize is when we say, well, Springfield's got it. Well, sorry, guys, so do we.
Right.
So don't just say Springfield anymore. It's true here as well. The second thing I would just say is that as long as that brother's vaccinated, his risk of transmitting it, even if he got it, is markedly reduced. And third, visit outside or just wear a mask if you're really concerned, and I think that's the way to go. And I think you can still visit, but you just got to follow the rules of infection control. And I'm not sure I'd be too nervous about Springfield versus Kansas City. I think we should just be nervous, period.
Dr. Pahud, this one I think you might be able to answer just real quick. Cynthia asked, she says, my coworker, age 70, was hospitalized, received O2 for a week with COVID in November. He believes he is fully immune and won't get the vaccine with the EUA. He is also concerned that he will have bad side effects if he does not get the vaccine. This is your chance to tell him that he will be okay.
We have data that shows that when you've had COVID, getting actually the vaccine gives you better immunity than having 2 shots. So you get better boosting after you've had the disease. Now, that's not what we want you to have. No. We want you to get both shots because you're still protected. But what I'm saying is, if you've already had COVID, getting that second shot is really going to help bring that immunity up to protect you, to prevent you from getting infected again. What we're also seeing is, if you get vaccinated or have COVID naturally, you're more likely to have COVID again from natural infection. Natural infection immunity wanes faster. It goes away faster, so you become susceptible faster. But if you had natural infection and you get the vaccine, you're better protected. So this is your chance to get better protected by getting vaccinated. At least 1 dose.
Okay, I have one more question from Ashley, and I think that we need to clarify here. If the survival rate of this virus is so high, 99%, right?
Why are we so worried? Because think about how many people live in planet Earth.
No, Dr. Pahud, listen. If the survival rate of the virus is so high at 99%, the survival rate of the virus is not 99%, right? She wants to know the reason. You asked, why don't people get the vaccine? If I have a 99% chance of surviving the virus, COVID, I'm afraid of putting those chemicals in my body. That's the question.
Well, that's not true, the 99% chance of survival. I just gave you the 1 in 500 death toll that the New York Times reported this morning.
Yeah, I think what they're saying. So if I get COVID, what's my risk of death? And it runs, and the risk of death is between 0.5 and 1%. It's somewhere in there. But it also is wildly dependent upon what your underlying conditions are, what your age is, what your other health status is, and how much exposure you got. So it's not a pure. You can't just look at that number and say, well, that's my risk. The second thing I would point out is, yes, that's true for death, but we haven't even talked about long COVID yet. And long COVID can get up to half of people. Yeah. So yeah, okay, fine, you didn't die, but now you're handicapped for the rest of your life because you can't breathe, or you're fatigued, you can't smell, your muscles are aching, etc. So yeah, you don't want to put a chemical in your body? Fine, you're going to let a virus in your body. Which of those makes better sense, folks? And remember that quote, chemical you're putting in your body is really just a way of stimulating your immune system to produce antibodies. So if you're not going to put that one in your body, why are you putting the influenza shot, the MMR, the DPT, or any other vaccination in your body? And by the way, why are you drinking coffee? Why are you smoking cigarettes? Why are you using marijuana? Those are all things that are chemicals
Cheetos
in your body, or eating Cheetos or other unhealthy foods. So you have to think about this from a real standpoint in terms of true logic and say to myself, this pandemic is now one of the unvaccinated. The Delta virus is much more dangerous, and by the way, that 0.5 to 1% may not apply to the Delta virus. So be careful what you wish for, because you may find that what you got is far worse than what you anticipated it was going to be.
And again, I hope that we're all human beings that care about each other. The measure of us becoming a civilization is when we found bones that healed, because people would go back and take care of their wounded. So maybe you will get COVID and you'll be fine, but you might have been the person that developed that mutation that made the vaccine ineligible for the rest of us. And maybe you are the reason why then grandma or your niece or nephew or somebody else in your family gets COVID because you passed it on. So do you really want to make this decision only based on what your risk is as opposed to the rest of your family and your community? I think that hopefully we are past that and we can think about us as a whole, not just as individuals.
All right, we're going to get to our final thoughts. We're going to continue this conversation. So not your final thought, just your final thought today. Dr. Pahud?
I think it's important to continue to mask if you're not sure who you're hanging out with, to convince people to get vaccinated if you have not. I know a lot of people out there, friends of mine, that are like, yeah, I'm going to get it. I just haven't gotten around to it. Get around to it, please. We're in the middle of a crisis here, and we are all exhausted, like we've said it. It's coming again. It's bad, and there is stuff we can do about it now. Get your vaccine. Get your mask on.
Dr. Lauer?
It is so important that our children, preschoolers, school-age kids, adolescents be back in school this year, both for their education, their mental health, their social development. We have to get them back in school. The past 2 school years, well, let's just say they haven't been good. So we know we have to get back to this. We know how we can do it. We just need to have the intestinal fortitude to do that and get through this next surge until we can get those younger kids vaccinated and people across the board are safe from this vaccine, or from the infection, and we can put the pandemic behind us, but we're not there yet.
One of the comments about our MMU is that we try to be hopeful and we're positive and we don't panic. And I think today you've heard our voice being more edgy. We'll try to be a little less fatigued and strung out tomorrow. But the reality is that we're all like that now, and we're that way because of the effect of the length of this pandemic, and it continues to go on, and it feels like forever. But it doesn't have to be forever, because there is an answer. In last fall, we bent the curve, and we bent the curve through social distancing and masking. What we really want to do is we want to eliminate the dang curve, and we know how to do that too. Social distancing, masking, and yes, vaccination. This is a pandemic of the unvaccinated. There's only one way to bend and break the curve. Our job is to break the curve. How do we break the curve? We follow the rules of infection control, we get vaccinated, we keep ourselves safe, we keep our community safe, and we say, I love you. So break the darn curve. Break the curve.
Great message. Can I end on a happy note? Cute kids,
Absolutely.
Shamelessly show a
We
picture of
should
my
do that.
kids actually out working. Okay, so thanks for being with us. But okay, picture of my kiddos. They were out hustling on the golf course, selling lemonade, and they made a killing on their own. And then they surprised me by saying that they were donating all the proceeds, all $91, Dr. Pahud, to Children's Mercy Hospital. Dr. Lauer, I told you that. I know they were very rambunctious when you saw them last week. I swear they're good kiddos. I swear. But then I went and told them that I would take them to Worlds of Fun.
That's perfect.
Am I crazy?
Well, but you know what? I bet you're going to make a mask, aren't you?
Absolutely.
There you go.
Absolutely.
Then
yes.
my answer is go have fun.
Yeah, we're going to go have fun, mask it up and have fun. So, all right, tomorrow's a great show because it's the official kickoff to the Summer Olympics, of course, without spectators, though. But 2 KC area gymnasts are sidelined as Tokyo. We've heard about this. They're quarantined after being exposed to COVID. So we're going to talk to 2 doctors who help train elite and Olympic-bound athletes. We find out what it takes to prepare your body to be the best of the best. So everyone have a great day. We'll see you tomorrow, 8 a.m.